Okay, inshallah, I think we'll begin. Bismillah ar-Rahman ar-Rahim. Alhamdulillah, nasta'inuhu wa nastaghfiruhu wa na'udhu billahi min shururi anfusina wa min sayyi'ati a'malina. Man yahdihillahu fala mudilla lahu wa man yudlilhu fala hadiya lahu. Wa nashhadu an la ilaha illa Allah wa nashhadu anna sayyidana mawlana Muhammadan 'abduhu wa rasuluhu sallallahu ta'ala alihi wa ashabihi wa sallam tasliman kathiran kathira. Subhanaka la 'ilma lana illa ma 'allamtana innaka antal 'alimul hakim. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to our webinar and our introductory session on the fiqh of gynecology, family planning and pregnancy. So inshallah, today what I'm going to do is I'm just going to give you a bit of an insight about the particular subject area, really up to, in essence, to open up your mind to the depth of this particular subject, and also in terms of the importance of this particular subject. And then what I will do is I will then go through some of the sessions that we will be covering, or the topics we'll be covering in the course, and then I will finally finish off with maybe getting some reflections from yourself. So inshallah, we'll begin first by just talking about the subject and its importance. So if you look at the title, you'll see that there are a number of different topics within the title. So there's gynecology, there is family planning, and then there's pregnancy. So if we were to go through that sort of in a certain tartib, in a certain order, then there's a holistic overview of the whole topic, which is in essence family planning. Then there is the understanding of gynecology and how that relates to this. And then finally, the issue of pregnancy, labor, birth, and various other things that go with that. Now, if we sort of look at it from one particular perspective, one thing that we have realized is over the last sort of 100 years, less than that, in fact, all these areas, gynecology, family planning, pregnancy, have been very medicalized. In essence, what that's done is it's placed a serious structure, which is a medical structure or a construct around them, so that we see them in a certain particular way. Now, we recognize that, and there are certain benefits in this. So, you know, the level of deaths on the basis of labor, the number of the mortality rates related to pregnancy, the mortality rates related to stillbirths, and so forth, have considerably reduced with the kind of advancements that we have in technology that we have. So as we are introducing this medicalized model of how we deal with all these areas, and also in terms of the advanced technology that we're using, this area gets very complex. And it starts questioning some of those very, very important areas that we take into consideration when we talk about the ethical, legal sort of angle to some of those discussions. So I'll talk about some of them as we go through some of the sessions. So inshallah, we will have a number of speakers who will be delivering on each one of the sessions. Each one of our speakers is somebody who's highly knowledgeable in this area, in particular the fiqh, as well as some of the engagement of the fiqh with as it intersects with science and some of the advanced technologies that we're using today in some of these areas in particular. So we like to think that the speakers that we do have a specialist interest in this particular area. So hence, we pick those who have the depth of knowledge so that you can be engaged with them, inshallah, not only in terms of the live sessions, but also in terms of their delivery and some of the expertise and knowledge areas that they have to offer you. So just before we go into the depth, I'll just start off by mentioning a couple of things. Now, I've got approximately an hour, so well, less than an hour now. So I'm just going to talk about some of the speakers. So there will be, even though we've got male speakers who are as part of the main context of the course team, because of the deep element of fiqh in there, we will have some female speakers who are not currently on the website, but they will play a very, very important role, in particular with regards to some of those sessions. So today's session is the introduction to the fiqh of gynecology, family planning, and pregnancy. So I'll elaborate on that once I've gone through all the other topics. So we will talk about Islamic medicine and its contribution to gynecology and obstetrics. There is an understanding that some of the advancements that we have in terms of how we deal with gynecological issues, as well as pregnancy, delivery, and the surgical elements around that, such as cesarean section and various other things like that, is a more recent thing. But there's a need for us to understand that there are many areas within this that were taboo, or they were seen in a negative light, in some of the preventing some of the technologies to be used. So cesarean section was clearly not something that was possible at one stage, whereas you'd find that Muslim jurists have been talking about dissecting the lower abdomen using certain instruments and various other things like that in that particular process. This is well before, you know, any kind of process arose, in particular the West, about you doing cesarean sections and various other things. So there's something about recognizing the historical context and some of how Muslim physicians in early Islam, in medieval times, approach some of these areas to give it context. And by doing that, it will allow us to understand the flexibility that our deen allows us in really developing sciences around these particular areas. Sometimes people have a negative understanding in terms of how Islam or scholars, Muslim scholars, have perceived some of these processes. We will talk a bit about them later on, and you know the sensitivity that arises with these processes. Just to give you an example, for example, having male, female clinicians dealing with these, or male clinicians dealing with female issues, is one particular sensitive area. Another sensitive area is exposing private parts, the aura. You know how Islam sees that in a very negative way, and there are a whole line of reasons why that is. And also in terms of some of the technologies where Islam would not allow us to take certain risks. So we'll discuss that as time goes on. But anyway, the main point there is it's interesting for us to know the historical context from an Islamic perspective about the technology that was used and the discoveries that were made by Muslim physicians in early Islam. Then we move on to the Islamic perspective on conception and family planning. So family planning has a very important connotation attached to it. And one of the most important connotations that attach to the issues of family planning, even though family planning in essence means how do you want to plan your future in terms of your children, how many children you should have, how you should space them in terms of the time difference between each child, to do the tarbiyah, to nurture them properly, and also to the ability that you can manage them. So it seems like a very reasonable sort of area to discuss, you know, in that sense, because it's clearly an area that impacts us in many different ways in terms of how many children we have, whether we have the time and energy to be able to nurture them properly, and having gaps between children. But it's become more about use of contraception and abortion. So it's sort of fundamentally driven with an unfortunate agenda, which has been more about preventing pregnancies and also aborting pregnancies or unwanted pregnancies. So, and as a result of that, that's a very sort of Western sort of driven agenda there that even Muslim countries have taken on board. Now, so there will be a big discussion around what does conception mean for Muslim jurists, for example. So we talk about conception begins at fertilization. So when fertilization occurs, that's where we have our chromosomal impressions that begin, that identify us as individuals, or identify an embryo that will become a human being or a human person. The question arises, when does Islam see that happening? When does Islam give that sort of morality or moral status? Is it at the stage of conception? Do we count pregnancy days or gestation the same way that we do from a scientific perspective, like we do today, which is, you know, so many weeks after conception? or so many weeks after fertilization. What was the historical understanding or the anatomical understanding or the physiological understanding about pregnancy from an Islamic perspective? Did they have a same understanding in medieval times, and did the scholars apply certain principles which produced the fiqh, the sort of substantive law in terms of morality of embryos at different stages? Is that in line with the science as we understand it today? So we have, fantastic technology today which can visualize an embryo, visualize a fetus growing in the womb through ultrasound and various other imaging. That was something that clearly wasn't available early in medieval times. So they worked around that. So it'd be interesting to know how they did that to be able to define different levels or different times of gestation, and then to understand this idea about family planning. So what was family planning from an Islamic perspective? What did Muslim jurists talk about? Did they use contraception in an early period, and what kind of contraceptions did they use? There's a process of al-azl. Al-azl is the withdrawal technique. That became a very fundamental pivot in defining principles around when it would, if at any stage, for us to be able to abort, for example. So that became a very, very important principle. So we need to identify what that principle is, recognize how that principle played a very, very important role about the discussions of issues like abortion as part of what Islam has to say about the embryological development. So Islam has a lot to say about embryological development. Islam talks about nutfa, it talks about alaqa, it talks about mudgha, and then it talks about lahm wal idham, and then it talks about khalqan akhar. So these are different stages of embryological development. How does our science link in with that? That's an important topic. And then it goes on to this whole issue related to conception, contraception, when it's permissible, when it's not permissible, and then also with the discussion around contraception. There are, we sort of see contraception as a reversible and irreversible types of contraception. What kind of contraception is permissible? Is the coil permissible? And can we use forms of sterilization? Are there any conditions for its use? Can we do vasectomies? Can we do tubal ligations? So these are important discussions. So Islam has quite a bit to say about that. So, if we don't have that understanding, Islam is very rich, and this is an immense discussion amongst the fuqaha regarding the different forms of contraception, and in particular the principles related to it. So how do we apply those principles to some of the really interesting kinds of contraceptions that we have today? We have many different forms of contraception. We've got barrier techniques, we've got injections, we've got hormonal treatments or hormonal uses of contraception, and how should we perceive them? Then we go on to the subject of abortion in Islam. Now, abortion is a very contentious issue, in particular because there is this understanding that Islam is very pro-life. But yet, when you look into the books of fiqh and you look into the books of the claims and the opinions of classical Muslim scholars, leave alone some of the contemporary ones, you'll feel and you'll get an understanding that there's a serious diversity in some of the opinions that exist there. So it's important to understand the different schools of thought around the discourse around abortion in terms of when do we give moral status? When does life actually begin? When does the life of a human begin? When is abortion considered acceptable? What are the conditions for abortion? For us to undergo abortion, if there are any? Do we have a very conservative approach to this? Is there some element of is there a window area, a window time where abortions can be carried out, but under certain specific conditions? What are those conditions? When is it not permissible, universally, that we cannot abort? So these kind of discussions are important. So that context behind this is very, very, very important, and that will be discussed as well. Then there is something about preconception care, ensuring health and well-being. So this is about not necessarily the fit, but this is more about how we should perceive pregnancy. How should we perceive the journey that a woman goes when she goes through a pregnancy? What's the spiritual perspective to that? How should we observe this from a solely spiritual perspective, rather than just the physical that we are very accustomed to, because we live in a very secular world, and pregnancy is seen as a very secular, medicalized sort of process. So, but Islam has a lot to say about the virtues of pregnancy. It has a lot to say about the concept of family planning, and how there is an encouragement of kathrat al-awlad, having abundant children. And the Prophet sallallahu alaihi wasallam says, this is a sense of pride in my ummah, that my ummah will have many children. It's a relative concept, relative to other ummahs, or relative to other nations, relative to other faiths, or relative to other cultures. So it's an important discussion. So from that perspective, how should we perceive conception? How should we perceive pregnancies? And what are the virtues of that? And clearly, going through pregnancy is not an easy thing. Women have to take on an immense burden when they go through the process of pregnancy. So, addressing that, inshallah, we will hopefully have a female speaker who will be discussing that in quite a bit of detail, relating the spiritual elements, understanding how one should work towards building a relationship with the unborn in a very spiritual way, and really trying to engage with the unborn child, or the fetus, or the embryo, to develop them spiritually even before they're even born. Okay. So then we move on. And this is an interesting area about advanced technologies. So there are many different advanced technologies that we're using at the moment in gynecology, in obstetrics, and also in prenatal care. So how should we address them? So there are many different ethical issues that arise from that. Is it permissible for you to know the sex of the fetus, the sex of the unborn child before their birth? Is that a permissible thing to do? Considering that we live in a society where there are certain cultures, or there are certain ethical concerns that we have, where there's a greater level of favoritism given to male babies or male children relative to females, and hence in those kind of societies there may be issues in terms of abortions occurring more so when families realize that they are to have a female child. So does that allow us to permit this this diagnostic in terms of the sex of the fetus? So they're important issues. So this is about imaging, and this is about many other areas in terms of reproductive technologies. So very recently we talked about synthetic embryos being produced. Okay, so this is about formulating the primordial sort of a medium whereby we grow embryos, and embryos with their own chromosomal makeup. And we're using reproductive technologies such as in vitro fertilization. So where we are able to get the male sperm, and we are able to get the female egg, and we fertilize it external to the womb, external to the in a test tube, or in an artificial environment, whereby once we've fertilized and we've had a certain level of growth there, then we inseminate this back into the womb. So those kind of processes, is that permissible? To what degree is that permissible? Now we've gone to a very different level of, in fact, genetically engineering the chromosomal makeup, the DNA, to avoid certain illnesses or genetic illnesses. How does that relate to this? So some of these technologies, in terms of CRISPR technology and various other technologies, are important discussions. So we'll be discussing some of that in terms of the advanced technologies in gynecology, obstetrics, and prenatal care. Okay, and then there's something about prenatal care and Islamic guidelines for expectant mothers. So this is more so around the sort of end stage of pregnancy. So this is about the guidance that we have, Islamic guidance regarding that. Also, how should a woman prepare for labor? How should a woman and a family prepare for a delivery? What is the fiqh around that? What's permissible? Should we encourage the husband, or should we encourage a female family member or friend to be present at the time of labor? What are the rulings related to retaining placenta and keeping a placenta? And should we bury it? So these are many sort of ethical legal discussions that need to be had in that particular situation. So then there are rituals that relate to this in the sense of during delivery. So Islamic approaches labor, delivery, and birth practices. So in other words, what are those rituals? So giving the adhan, doing the iqama, and also tahniq, all these sort of rituals that Islam encourages and the sunnah. How do we do that in a very clear medical setting? Because it's not like it used to be. Women delivered at home, and there were midwives that would deliver them at home. But now that's different. Now they're doing it in a hospital setting on a labor ward, and there are male clinicians, there are male obstetricians. So there may be other family members. And what is the permissibility in that? Can we use nitrous oxide? Can we use artificial inducers of labor? Can we use sort of chemicals like this or drugs like this to speed up the labor process? And even at what time and what circumstances would it be permissible for us to go forth and do emergency cesarean sections, for example? Yeah. So there are a lot of questions around labor, delivery, and birth practices. And there's not directly related, but indirectly related issues around purity, like nifas and tahara. So purity in terms of reading your salah. When should a woman read a salah? When would it not be considered right for her to read her salah? When does she have to do ghusl? And various other things. So those kind of things will be discussed in the discussion around Islamic approaches to labor, delivery, and birth practices. We go further on into discussions of rights of fetus and neonate. And these are areas that we have very little understanding, but yet they're very important areas. So do you know that a child that's not born yet can inherit, for example? Yeah. So there are what we call ahliyat al-wujub, and we have ahliyat al-ada. And Islam recognizes a certain level of moral obligations that we have towards fetuses and their rights, even before they're born. How do we work around that? So inheritance rights is one, and there are also rights that we don't harm and various other things like that. So even though that might be a topic that we might have some kind of understanding on, is it permissible to smoke? Is it permissible to take certain drugs when you are pregnant, for example, when there is a risk? What level of risk can we accept in Islam? And various questions around that. So that relates to the moral status of the fetus and the neonate. And it also talks about issues in terms of their rights and obligations and various other things. Then we go on to the topic of addressing high-risk pregnancies and complications. Now, that sounds like a topic that might have been discussed in one of the earlier sessions, but no, it's quite different. Because here, the discussion is more about a fetus that has severe congenital anomalies or problems. So, and we may have gone past ensoulment now. So this no longer is just a fetus, it's actually a human, because it's an ensouled human organism. So it's a human person. So if it's a human person and we have noted that they have severe deformities, severe congenital anomalies or disabilities, How do you go around that? Do we, usually in certain cases like that, you may find that a lot of discussions about, because it may be around about 20 weeks gestation pregnancy, at that particular time, it would be considered as a human person. But yet, according to the law of many states or nations, you will find that you would be permitted to abort at that time if there are, serious congenital concerns. So on the basis of this, what does Islam have to say about that? What are our obligations to act? So let's say, for example, we have a neonate, a newborn that's just born, and yet they have, some serious issues of failure to thrive. What are our obligations in terms of treating them? Do we have to treat them aggressively to keep them alive? Is there some scope in Islam where there is no obligation to treat, for example? So those kind of discussions are very important. And in fact, many of the questions I sometimes get are related to those kind of very complex areas. So that kind of discussion is important. And that will be also mentioned in a session here, addressing high-risk pregnancies and various other things like that. Recognizing also there are issues in terms of the mother's health. So mothers may have, certain medical conditions where they put themselves at risk as well. Then there's something about postpartum care. So this is when we talked about a bit earlier on about not just labor, but beyond that. And this is about nifas, this is about breastfeeding. What are the virtues of breastfeeding? Or does Islam have anything to talk about in terms of weaning even? And also discussions around contraception after birth, sterilization during delivery, especially if it was a cesarean section. Those kind of discussions are very important as well. And that follows on from the topic of tahara and purity and various other questions around that as well. Then we go into a really interesting discussion about infertility treatment and assisted reproduction technologies. So, so this is more gynecology. So here we have the subject of infertility. How do we deal with the issues of infertility? What does Islam have to say about that? Somebody who's infertile or subfertile, and questions arise in terms of surrogacy. Questions arise around even sort of some of the more recent discussions about uterine transplants, womb transplants. Questions arise. So in that sense, the biggest question or point of contention is this really important element of the higher objective of Islam about linealogy and parents having a recognized lineage of who the parents are. So in a case of surrogacy, for example, even though you can say surrogacy is not permitted, let's say we're in that situation now where it's happened. Who's the mother? Who's the father from an Islamic perspective? Who has a right over the child from an Islamic perspective? So there are many sort of legal complexities that arise there from an Islamic perspective, and that needs addressing. So that's quite important. And also, is there a necessity for women to seek fertility treatment or means in terms of enhancing their fertility in those situations, or should they have sabr? So these are important questions that are essential for us to open up and discuss and investigate. Then we have something about gynecological healthcare, balancing medical practices with Islamic guidelines. So this is about sexually transmitted diseases, the concept of confidentiality, concepts around consent. That can even go into areas which we move on here into the next one, which is about making decisions around gynecology and obstetrics in the sense of smears, doing smears, so cervical cancer risks, is having a 𝐁𝐚 𝐲𝐴, is that permissible, for example? So there's a lot of questions around that. When is it permissible for a woman to have a gynecological examination, for example? Yeah, so a pelvic examination, a gynecological examination. When is that permissible? So there's a lot of questions around that, which are important to address. Also, moving on to some of the other areas, such as providing culturally sensitive gynecological services to Muslim patients. So it's important for us to understand that what is the ideal situation, what is the ideal setup, even though things are permissible regardless of that setup. What is the ideal? So, you know, what kind of environment would we want to have as Muslims to ensure that that environment is culturally, religiously sensitive for Muslim patients? Then also Islamic approaches to human cloning. So more sort of detailed discussion around genetics, designer babies. What does Islam have to say about that? You know, we recognize that there are certain genetic engineering that we can do, or gene depletions that we can do, where we have serious genetic conditions that are passed down from generation to generation. What's the scope for that from an Islamic perspective? This is a very recent discussion and very recent sort of need for jadid masail related to some of these issues. So what is the scope in that? What is permissible in that? What's not permissible in that? Because if we open the door to allow genetic engineering or genetic sort of depletion or whatever to avoid disease conditions, can we also use that same technology to enhance humans in certain ways? Yeah? So in terms of even in terms of their memory, even, or in terms of other features that they may have, so that we can insert certain genes that would give us a greater chance for us to have some kind of resistance about us ending up diabetic, for example. Yeah, so that is a form of enhancement, genetical sort of therapy. So, you know, it gets very complex when we start defining what it means to treat an illness genetically, or when we are enhancing a genetical sort of makeup to enhance and prevent certain illnesses. So, you know, it becomes, because this can be abused. You know, we can have enhanced treatment, and if people start getting onto this fashion of designing their babies in this sense, you know, you can imagine some of the ethical issues that would arise from that. So, you know, it's an interesting discussion. And then finally, a Q&A at the end of it. So these are some of the sessions that we will be delivering on, inshallah, with a number of different speakers. And we'll have plenty of opportunity to discuss them. So I've gone into quite a bit of detail about the different types of levels of discussion around this. So I've got a few some time to discuss a couple of issues. So very good point. So there's a question of topic of grief and loss in pregnancy or birth be discussed. Yes, there will be. So that would be discussed mainly around discussions around miscarriage, so isqat al-haml, and then there'll be a more of a spiritual discussion based with that, as well as also stillbirths, and you know, abortions that occur. I'm talking about spontaneous abortions that occur later on in pregnancy, which can be very, very emotional. So, and also even you know, not necessarily stillbirths, but deaths at early age, you know, a neonate, a recent born baby, and deaths in them, and how to cope with that from an Islamic and spiritual perspective, because our deen has quite a bit to say about that as well. So yeah, alhamdulillah, we'll be discussing things around those areas as well. Home births, yes. So Fariha Subar is talking about home births. Yeah, so we will hopefully, inshallah, talk a bit about that, because we recognize that pregnancy, labor, and various other things like that have been very medicalized. So it's important for us to recognize, you know, alternative approaches to this. to open up our mind and realize that things don't necessarily have to be medicalized in this particular way, you know, and they can quite easily not be. So yeah, so in that sense, we need to discuss that as well, inshallah. Yeah. If there's any questions that anybody has, I'm quite happy to take your questions live. If you give us some kind of understanding about, in terms of where your background is, which country you are at, your profession, and also any particular questions you may have, or any particular things you like to ask, or you would like us to offer as part of this course, for example. So please do ask. Raise your hand, inshallah, and I will allow you on. Please do. It'd be interesting to hear your views as well. So this is the first time we're delivering this course, and because it's the first time we're delivering this course, you know, there's a lot of learning that we need to do in terms of how we can deliver this effectively, so that it deals with some of those really important discussions that you want us to have with you, using some of the expert sort of background that we have. So please do raise your hand, inshallah, and I will allow you to talk. I'll go through some of the other questions. We've got an anonymous person here. Is this webinar the intro to any upcoming Al-Balagh course? Yes, this is a webinar to the course on the Fiqh of Gynecology, family planning and pregnancy. So that's initially, it's an introduction as well as a webinar. So will there be a discussion about the psychological impact of infertility and the methods of self-therapy and healing, especially while living in an environment where the women are blamed for the inability to have children? Yeah, there are many misconceptions. So there are misconceptions about a couple always having female children, for example. There's a misconception, and, you know, blame the mother, you know, and that's the way to deal with it. So there are many misunderstandings and misconceptions. They will be addressed. Also, the issue about subfertility, infertility, and misconceptions about that as well. So we see that in a very negative light, which, to be honest, it's you know, it is a test. You know, it is a test, a severe test for many people, to be in a situation where you are not able to have children. But Islam does have a lot to say about that, how we should address that from both a spiritual way and also from a practical perspective, you know, such as fostering, adopting children, and various other things. There's a topic around adoption. Does Islam allow adoption? And if it does allow adoption, what are the conditions in doing that? Do we see adoption in the same light that we see it today from a quite Western perspective? Is it seen differently? So there's quite a bit to be said about that. So yeah, there will be discussion about that as well, inshallah. Okay, just 1 second. So just waiting for anybody who wants to raise their hand, sorry. You got a couple of other questions, I think, on the Q&A. Maybe I'm not seeing you raise your hand. Yeah, okay, we got Fariha Subar. Okay, we'll allow you to talk.
Alaikum.
Wa alaikum salam.
Jazakallah khair for the informative session. I wanted to ask, you mentioned at the beginning how pregnancy and birth was becoming very medicalized now, or it has become medicalized. I was wondering if you was going to cover topics relating to, or discussion related to how we can unmedicalize it, and maybe go back to how Allah has naturally given us the ability to go through pregnancy and birth our babies, including family planning and preconception, whether that was going to be part of the course.
Yeah, that's a very, very important part of the course, actually. So we are trying, we recognize the advantages and the benefits of medicalizing it. Clearly, it's reduced death rates and various things like that. So, but what sometimes happens is, as a father myself, being somebody who was present in the delivery of my wife, you know, there's a certain mindset you go in with, and the mindset tends to be more focused on, you know, we want a healthy baby, you know, and we forget about the spiritual aspects of that, you know. So that there's a very important spiritual component to this that we overlook. Also, because it's a very frightening time, people get very frightened during labor, because it's, you know, it's a very testing time, and for that reason, there's an important sort of discussion to be had around preparation. Yeah. So the preparation is not necessarily a discussion around the medical setup, but the preparations is a discussion around the psychological mindset, the spiritual mindset, the approach, the fiqh. Fiqh is a very important science related to acts and practical implementation. So there's an important discussion to be had about that. You know, what is permissible in an environment like that? What is impermissible? You'd be surprised. There are certain things that you felt may have been seen in a good light from an Islamic perspective, but Islam has a lot to say about not allowing that. And vice versa, some things that you may think, oh, you think Islam wouldn't allow that, but yes, Islam would allow it. So those kind of discussions are very, very important. So yeah. So we will be looking at that. Does Islam encourage for you to deliver at home? Let's discuss that. Let's investigate what Islam has to say about that. You know, is that a better environment than being in a hospital environment? These kind of setups are offered to women, you know, and to families. So yeah, you know, these things will be discussed, inshallah. Okay, we've got somebody asking, how about advising that can be given to Muslim doctors dealing with transgender patients? That's an interesting area. We've not really thought about that one. So yeah, important. It's an important discussion. So okay, so gynecology probably more so. Yeah, sort of relates to this issue. Probably less so obstetrics. But yeah, gynecology would be a very, very important topic to talk about when we talk about that. So here we're going into the subject of sex and gender and transitioning. So that's an important topic. What we have done is we've not really introduced that topic here because that's a huge topic in itself. And inshallah, what we're hoping to do is have a separate course on that about the issues of LGBT, transitioning, transgenderism, and all those other areas. We're hoping to have a whole course on that. So we want to leave it for that, inshallah. So even though those questions might arise in some of the relevant sessions, probably more so around the gynecological sort of aspects, inshallah, we won't shy away from that, and hopefully we will talk a bit about that as well. But yeah, very, very, very good point. Very good point. It's an important topic. Okay, if there's anybody else who wants to ask a question, raise your hand. Okay, we've got a couple of other questions here about. Let's go through it. What if I'm not prepared for this pregnancy? I don't want this child. I already have 2 small kids. So that's a discussion around family planning. That you don't want this child. You don't want this child. What's the reason behind it? It's because I want to space them. Okay, fair enough. So what will Islam allow me to do in that kind of circumstance? Does it allow me to use contraception? And let's say, for example, I did not use contraception and I became pregnant. What are the conditions? What are the limits to what's permitted? Am I allowed to abort? Am I allowed to use the morning after pill? Am I allowed to have a coil? Yeah, as a means of slightly delayed form of contraception. So yeah, you know, this is an important discussion. So we will open up that discussion and talk to it in more detail. Another question: if a pregnant woman who do Sharia, okay, if a pregnant woman does hijab and is unable to do so in pregnancy due to breathing and high BP, okay, so this is the setup that is there for delivery. So, you know, there can be circumstances where, you know, especially where there's a difficult delivery, where certain aspects of Islam can be compromised. For example, exposing the private areas, a woman being in a certain position, and so forth. Those kind of things can be compromised. Sometimes very difficult for a woman to maintain her hijab in those kind of environments. So how do we address that? And that's an important discussion. We'll open that discussion. We'll talk about that. We'll talk about the rulings related to aura. We'll talk about the rulings related to khalwa. These are about, male being there. What are the rulings related to that? These are non-mahram male clinicians. What are the rulings related to that? Is that acceptable? And even the discussion about non-Muslim midwives, interesting enough. Is that permissible? So yeah, that's a discussion to be had, because that's an opinion. Yeah. So there's a discussion to be had about that as well. Yeah, definitely. So yeah, in that kind of environment, what kind of things should we be conscious of? So there's something here about, I want to give proper time and attention to my 2 toddlers now. I'm not in physical and emotional state to have another one. I have had 2 C-sections. I also don't have human support. Okay, so contraception is an option. What kind of contraception? So that's the big question there. So can we undergo sort of treatments such as tubal ligation? Yeah. So sterilization, is that acceptable? What are the conditions for that? Sterilizations can be reversed. So is it still to be considered as a reversible contraception, or is it to be considered as irreversible contraception or permanent contraception? So yeah, so that's an important discussion, especially with new technologies that we have now, where we can see that you can reverse even tubal ligations, and there are pregnancies that occur even after that. So yeah, so that's another area of discussion, definitely. Okay. There's been a lot of discussion, more so from the patient perspective, or the mother's perspective, or the family's perspective. It'd be interesting also to know about the doctor's perspective, or the clinician's perspective, or the midwife's perspective. And yes, we will do that. We will provide you a perspective from all ends, definitely. So okay, we got another person who's raised their hand. So we got Fatima Suleiman. Come online. So we got a question: how long will the course be? Our courses are no longer than 3 to 4 months. So 4 months maximum. That's usually the case. Our short courses. This is a short course. So the question is, what if I am not pregnant prepared for this pregnancy? I don't want this child. I already have 2 small kids. Oh, we've had that discussion already, haven't we? Okay, I'm in a very early state of pregnancy, and I have had 2 C-sections already. I have 2 small toddlers. I'm still breastfeeding one. I don't want this child. I am not prepared for it. What can I do? Again, the discussions about abortion. So I am a maternal. I'm not going to be answering fiqh questions today. That's not my purpose. My purpose is to introduce the course. If you have a real interest in the course, please do join the course. I am a maternal wellness educator and birth attendant practicing holistic midwifery in the States. I would have loved to see female presenters in this program. Is there a particular reason there are only male speakers? I don't know if you were here right at the early stage, but yes, there are female speakers. There will be female speakers. I have to admit though, and I'm going to be very frank with you. When it comes to the detailed fit related to, because there's something about training somebody to be able to present on a subject, but sometimes we have very interesting complex questions that arise in sessions where we need somebody who has the deep expertise from the fiqh perspective, and unfortunately we struggle to find female scholars who have that depth, unfortunately. Hopefully, inshallah, as time goes on, that will be addressed. But having said that, we have a number of female speakers who will also be delivering sessions, inshallah. So especially the ones where there is a real need for that touch and that sensitivity from a female perspective, definitely, inshallah. So there will be. So we got I live in a country where STIs are very common, and homosexual patients with STIs come to the hospital often. What does the Sharia say about Muslim doctors treating them? Very important question. That will come in our gynecology sort of area. about STIs, and we will talk a bit about sort of homosexuality. But we will, like I mentioned earlier on, there will be a whole course just on this subject because it's quite complex, and you need to understand a certain number of principles before we even go into that course. And sometimes to have sessions just on this might be difficult to fit in. So for that reason, we'll have a separate course on it, inshallah. But that doesn't prevent you from asking those questions. I've got a question. The decision to use contraception, whose decision is most considered according to Islam between husband and wife? That's a good question. So does the husband have a say? Yeah, good question. In fact, let me reverse that. Does the wife have a say about the husband, using withdrawal technique as a form of contraception? And that's an important question. And you will have to join the course to find out. And then there's another question about vasectomy. Is vasectomy halal or haram? So that goes into the discussion of irreversible, reversible contraception. So inshallah, we'll talk a bit about that as well. I think we've got Fatima on, but I'm not sure whether it's because you've accidentally raised your hand. So I don't know whether you want to come on or not. If anybody else wants to come on, we've got a few minutes left. If you want to ask any particular questions, please do come on. Okay, there's a couple of other points here. Let me just go through them. Okay, so request. So we've got a question here. I will definitely enroll myself in this course. There will be very important contemporary discussions of this course, which is a must for scholars, inshallah. Looking forward to it. Yeah, so we have an alima here, so who's Aisha Khizr. So she's one of our instructors as well in some of the other courses. So yeah, so this is very catered for Muslim scholars. It's very important for Muslim scholars to have an understanding about some of these very, very important topics. So I highly encourage those of you who are female scholars and male scholars, to please join this course. It's very important. A lot of this will be related to female issues, but we will also be addressing males in terms of in the capacity of husbands or family members, and also in the capacity of clinicians. So we have a lot of doctors and clinicians who are male who do deal with this area. So inshallah, we will address that as well. So we have Mehnaz Nouri saying, I am keen in enrolling for the course. I am a birth coach and doula. I just joined in. Can you please brief more how beneficial it can be to enroll? So yeah, I've sort of talked a lot about that throughout the whole course. There will be a recording available to you, so you can listen to the recording. Please do so. But yeah, I would say very important. I would say very important. You will not find a course like this out there. We'll go into quite a bit of depth. It's not just about the fiqh, it's about its implementation. It's about seeing the whole journey from family planning, conception, prenatal, pregnancy, labor, postnatal, and even the period after postnatal, i.e. times of nifasa, for example. All the ethical legal issues that arise throughout the whole of that journey, as well as practical tips, practical points. How do you bring spirituality into it all? How do you earn reward by going through that journey? Also dealing with issues of grief, like, for example, miscarriages, stillbirths, early deaths, neonatal deaths, and things like that. How to deal with that, spiritual aspects behind that as well. So yeah, there will be some important discussions around that as well. Even though our sessions have been mentioned and the titles have been lifted there is some scope of flexibility in terms of how we orchestrate some of those sessions. So some of those titles may change slightly to cater in particular to your needs. So clearly, when we recognize that you want us to talk more about a particular area, we might change some of those titles and the content of some of those sessions. There's a question regarding haid, menstruation. Can a woman perform tawaf of Hajj in menstruation? The simple response to that is no. She's not in state of tahara, so no. But addressing the question of menstruation will not be merely part of this, even though we have a course on this. So those of you who have interest in this area regarding tahara and menstruation and salah for women, there we have a separate course. Please do join that course. Okay. Okay. We recognize we can't cover everything. Okay. The session will be interactive. There's a question: is the session interactive? The session will be interactive. Is there any link between family planning, pregnancy, and women well-being issues with multiple marriages of men? That's an interesting area. Yeah. So men who are in polygamous marriages, so basically they have more than one wife. Okay, I don't see there's a direct link to the topics that we're going to be discussing here, because it'll be about pregnancy, family planning, but I can see it from the family planning perspective. Probably more so the discussion might fall in the subject of fertility, infertility, because that's where some of these issues tend to arise. So yeah, from that perspective, we can come into that. You can engage the course, you can drive the course to whichever direction you want to drive it, because you're the ones who will be interacting, you're the ones who will be asking the questions. So a lot of it will be focused around how you want to engage with this in that sense. Please, since this is to do with couples, kindly try to clarify individual rights of each spouse in the course and their duties to each other. Okay, so we're going to try to avoid going into the details of marriage, okay, and issues related to marriage. We've got a whole separate course on marriages and the psychology behind marriages, counseling around marriages, and various other things. So we're trying not to overlap too much with other courses that we have. So yeah, we can discuss. So if you know, as a question that arises in one of those subject areas, you know, by all means ask those questions, and you know, if some of our instructors have that area of interest, they can respond to those questions. Just confirming, will we be covering only Hanafi fiqh? No, you won't be. Those of you who are accustomed to Balagh Academy will recognize, even though we have a lot of Hanafi scholars in particular, we cover the whole madhahib scope. Yeah, the Sunni madhahib scope. So the Sunni schools. Those of you who are familiar with Balagh Academy will recognize that we do cover all the different schools of thought from the Sunni perspective. So yeah, Khatija Wan says, please, since this is to do with couples. Okay, we've asked that question already. Addressed that. Okay, right. Do we give any private counseling regarding family planning? This is not a service that we provide on Balagh Academy, but I would have to say that if you join this course, I cannot see that you will not be informed enough for you to be able to address your concerns, and you can ask the odd questions with our instructors as well. So inshallah, if you do join the course, I'm sure a lot of the key issues that you will have regarding that will be addressed. Okay, we've got one or two other people. So okay, so I think Fatima's raised her hand, but I think that's an accident. Okay, inshallah. So that's our time over. The course is about 3 to 4 months, like I mentioned earlier, inshallah. So hopefully that's been interesting, and I'm sure that many of you have found this you know, quite important, because it is important. And if you've taken away with that message, then I'm sure that you will recognize that there's a need for this, and hopefully you'll join us. So inshallah, it'd be good to have all of you there. Please continue with us, join us. There's a link there, and inshallah, hopefully we'll see you soon on the course. Jazakumullah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.